Okay, so hello, good afternoon. There there are quite a number of you who've been raising questions in the inbox about a lot of things. So we thought that we introduce a segment where we, address some of the questions that you bring, just in case there could be somebody else who has a similar question, so that others also may benefit. So do tell us where you're watching us from. So this segment will be for 30 minutes, and this particular segment is sponsored by CarePick Specialist Clinic. So on this segment, we'll be coming with a segment called A Quick Chat with Dr. Mujajati. This is where we just basically take any random question that you have live right here. We answer questions and we see how far we go. So go ahead, start asking questions. Uh, Go ahead, bring us, your questions, and then we address them. All right. So let's see if you have any questions for us. If there'll be no questions at 15:30 itself, we will have ended this segment. And yeah, okay, there's an issue here. No, there's a question. I've missed it here. There. Yeah, that's the question. So Mubiana is asking, Mubiana Maliwa, doctor, what causes lymphedema and is it curable? Now, lymphedema, understand that this is where someone is swelling either on the legs or hands or any part of the body because the lymph or lymphatic ducts or the tubes that are called lymphatic ducts are blocked, and they can be blocked either by cancer or by anything. Um, but there's a specific infection, the one that causes elephantiasis, that is quite commonly associated with lymphedema. That is why you find that when people are doing pre-treatment for elephantiasis, in as much as I've seen like quite a few people take the drugs, that medication you should take it because if you live in this area which is prone to elephantiasis, it's very important that you take that pre-treatment. Now, lymphedema in general is extremely difficult to treat because lymph nodes, lymphatic ducts are first of all very delicate, very difficult to operate on. So what people do is that they may give you, there are some tight socks that they can give you that help with, reduction of the swelling. But to completely heal lymphedema, again, depends on the cause. If it's a tumor, if they remove it, maybe, you might recover. But generally speaking, lymphedema is extremely difficult to treat. But the commonest lymphedema you will find is one which is associated with elephantiasis. Okay, questions? Kenawa Lifanu. Doctor, what causes a ringing sound in the ears? All right. Do you have an infection? Because that can also cause that. If you have otitis media, if you have an infection. The other question I'd ask you, if this is what you have, is that do you have a discharge and is there pain in the ear? If those are there, then usually you find that the course of antibiotics should help you. But also sometimes, if you have a serious impact of a serious impaction of wax, it can give you this kind of problem as well. Okay. All right. Another question here. This is Grace Mwewa. So Grace Mwewa, the question you have is, doctor, what causes sore throat and what medicine may you take? Can you take? Okay, good. So sore throat, generally speaking, is because of a bacterial infection. That's generally speaking. Although you can have a sore throat because of a bacterial infection. So sore throat, this is an infection at the back of the mouth, way at the back. And usually you will find that the commonest presentation with sore throat comes with also with it, tonsillitis. And so usually because of that, some people may also either have a fever in addition to it, they'll have a headache, they may have difficulty swallowing. Others may also present with a blocked nose, difficulties to breathe. So a course of antibiotics with some painkillers usually takes care of the problem. All right. Next question. Okay, this one is interesting. The question is, this is Vanessa Chilwa. How come questions are just coming from ladies? I need to find a man here who can also ask a question. It requires man. Okay, so Vanessa Chiluba Nambeye. Her question is, what causes tingling sensation on the feet, especially at night? Now, tingling sensation or pins and needles, don't ignore that symptom, because it therefore means that you may have what we call peripheral neuropathy. And peripheral neuropathy, we see it very commonly in diabetic patients. So if you are not already diabetic, this could be the sign, or this will be a sign that you are diabetic and you need to be evaluated for diabetes so that we know for a fact. And then also, you may have vitamin deficiencies, especially the B series vitamins. You may have, one of those B series vitamins that is deficient. The other issue is that if you do take alcohol excessively, this could be an issue, but you might also have another illness that is affecting your peripheral nerves and is affecting your nerves. So those are the common things we look for in your situation. All right. Of course, that's notwithstanding the possibility that probably you have a nerve entrapment. Remember, if you sit on your nerve, the sciatic nerve, if you're not sitting properly and you squeeze your nerve, you'll find that you may have pins and needles in the leg. But you may see that the issue with nerve entrapment is that if you change your posture, the pins and needles or the tingling sensation gets relieved. Okay, this is Andrew Mwaila II. Doc, what could be the cause of inguinal lymph nodes swelling? Okay, they are non-tender. Okay, when they say non-tender, it means they are not painful. Bilateral, it means they are on both sides. Maybe the inguinal lymph nodes may be palpable in males. Okay, fine. So what he's asking is, what is the cause of swollen lymph nodes now around the groin area in males? Okay, now the issue with swollen lymph nodes around the groin area, they happen with everybody. Now with lymph nodes, now the language in this text suggests that the person who's asking is a health worker. Now I need you to appreciate this, Andrew, that when you're evaluating a patient who has lymphadenopathy, the question you must ask yourself all the time as a clinician or as a doctor or as a licentiate or as a nurse, if you're the one who's assessing the patient, is this lymphadenopathy or is this enlargement of lymph nodes significant or not significant? Now, what makes lymph nodes significant? One of the criteria, it's not the only criteria, but one of them that we use is size. So generally speaking, even if lymph nodes are enlarged, if they are less than 2 centimeters, okay, in diameter, they are less than 2, depending on where they are. So lymph nodes in the groin area, if they are less than 2 centimeters, you'll find that most people probably just say, these are not significant. You know why? Because you have a lot of infections that drain from the legs, from your groin and anywhere, or injuries that drain in those areas that are probably natural. So if lymph nodes are less than 2 centimeters, most health workers will tell you this is not significant. But if it's lymph nodes in the neck, lymph nodes in the armpits, lymph nodes there, if they are 1 centimeter or less, you'll find that people don't bother. But if lymph nodes in those areas are more than 1 centimeter, they will tell you we need to take a biopsy on this. So just bear in mind, it's not just the lymph nodes being enlarged, you also have to bear in mind what's the size. The other issue also is that what's the texture of the lymph node? Is it hard when you touch it? Is it hard? Or is it irregular? Or is it rubbery? Or are they clamped together? Okay, so sometimes you find that lymph nodes may be small in size, quite all right. In terms of size, it doesn't meet your criteria. But if they are clamped together, like what you call it? Like grapes, they are bunched together like grapes, then those lymph nodes become important. Usually you find that it's TB, and TB is on top of the list when lymph nodes are clamped, or is it a tumor? So it's not just that lymph nodes are enlarged, you also have to look at the texture. Okay, and also the other issue is that yes, a lymph node is enlarged quite all right, but is it fixed either to the skin or to the surface? If a lymph node is fixed and you can't move it, or when you move it, it's moving together with the skin, or it's moving together with structures at the bottom, then that lymph node is probably because of a cancer and it needs to be biopsied. So it's not enough to just say, oh, a lymph node is enlarged, therefore let's remove it. You have to describe the lymph node properly, especially if you're a health worker who's examining the lymph node. And also, the other issue with lymph nodes is that be very careful. It also depends on the distribution. If an enlarged lymph node is solitary, as in it's just one enlarged lymph node in one area, it may mean something different. But also, could it be that the lymph nodes are enlarged and they're enlarged generally in various parts of the body? Then it means that you're dealing with a much, much bigger problem. All right? Next question. That's a good question, though. Although I'm very certain that this question was asked by a health worker. Okay. Ian C. Chilangwa. Doc, what is the pathophysiology of glomerulonephritis in relation to sore throat? Okay. This definitely is a health worker, pathophysiology, shani. Okay, fine. So basically, the question asked simply is basically asking us, is there a relationship between kidney disease, which is glomerulonephritis, is kidney disease, and an infection in the throat? Now, let me put it this way. Generally speaking, the infection on the throat, generally speaking, tends to affect the heart. It is the infection on the skin that tends to affect the kidneys, which is linked to glomerulonephritis. So the relationship is that the bacteria that may infect the skin, when your body reacts to that bacteria, it will form, your body will produce proteins that will attach to parts of the bacteria. Now, what tends to happen is that that combination of the components of the bacteria and the protein from your body, when they form a complex, that complex can very easily go and deposit itself in your kidneys. And then your own body now begins to attack your kidneys. So that's how it happens. That may not be the only mechanism. The other mechanism is called mimicry. Mimicry is where the bacteria which is attacking your skin, or even your throat sometimes, in terms of molecular structure, is similar to the glomeruli, which is the structures in the kidneys. So your body or your immune system is not able to distinguish or to tell the difference between a bacteria and your kidneys. And when it is attacking, it will attack both the bacteria and the kidney at the same time. So glomerulonephritis, you find that it happens because it is your immune system which is mistaking your kidney for a bacteria. So that's how it happens. Okay, next question. All right, this one, it's the difficult one. This is SNAT. SNAT cheating. Doc, is it possible to completely get rid of thoracic spine pain? Does malaria usually come with thoracic spine pain? What treatment is given to get rid of it? Okay, fine. So this person has back pain, and the pain is in the spine or the backbone, if you like. So they have pain in the backbone, and the component or the segment of the backbone which is affected is the one which is around the chest area. That's why they're calling it thoracic. Now, when you have pain in the backbone, understand that malaria that you are mentioning may not necessarily be linked to the problem. So if you have malaria as well, it may be a separate issue. You may have two separate pathologies. So you could have what we call a disc prolapse, okay? A disc prolapse, because your backbone has discs and the disc may have prolapsed. The other issue is that you could have what we call TB of the backbone itself. So if you have TB of the backbone, you can actually present with this type of thing, except that with TB of the backbone, there will be a deformity in the backbone. The other issue is that you may have chipute, an abscess, okay, a paraspinal abscess. All right, you might have that. The other issue could just be spasms. You know, you have muscles around the backbone, and those muscles may form what they call knots, or may become spastic, or may have spasms. And the pain may not be in the backbone itself. The pain may actually be in your muscles. Now, in a situation like that, where the pain is in the muscles, the best people to see to resolve your problem is a physiotherapist. A person like me may not solve your issue. So you need to see a physiotherapist to sort out your issue. All right. Next question. This is an interesting one. This is Belinda Lusanso. Doc, is it true that taking elephant dung reduces hypertension? Okay, so how do you take the dung? Do you take it fresh or dry? Do you make a stew? Do you make coffee? So how do you eat it? So I don't know, to be honest. And I'm hearing this for the first time, that people actually take or eat elephant dung to manage hypertension. You don't need to go that far to go and eat animal excreta to manage hypertension. We do have drugs for managing BP that you can rely on. You don't need to go as far as consuming animal excreta like elephant dung to manage hypertension. There's no need for you to go that extreme. Personally, I would discourage it simply because in terms of managing BP or hypertension, the options in terms of drugs are many. You are not short of options. So just stick with the conventional treatment for that. All right, next. What is the next question? Okay, let me do this. Let's do this. Okay, this one is interesting, huh? Let's see. Doctor, hey, this is Ray. This is Ray Annie. Ray Annie. So Ray Annie, the question is, what causes people to die from gases? Is it gases or something else? I have a friend's wife who died from gases. Even late Lily T died from gases. Okay, here's the issue. I don't see how gases can kill you. I don't see how. Gases themselves, because right now as we speak, everyone who is watching this has gas in their stomach. It becomes a problem when gas becomes excessive. Now here's the issue about gases that I need you to appreciate, is that when gas is excessive, it is not the gas which is an issue. There's an underlying problem that is causing the gas to be excessive. And that's what you need to identify. Is it that this person has an ulcer? Now, if the person has an ulcer in the stomach, yes, the ulcer can kill you. If it's not properly treated, it can. And here's how. The acid in your stomach, if I can manage to extract it and I put it on a piece of metal, it will dissolve metal easily, very easily. Now, your stomach lining has enough protective mechanism to protect you or to protect the acid that you are producing in your own stomach from dissolving your stomach. Now, what usually happens is that there's a bacteria that can survive the acid. It's called Helicobacter pylori. Now, that particular bacteria, it has the capacity to destroy the stomach lining that protects you from the acid. When that happens, the acid now will have direct access to your flesh and it will start dissolving your flesh. And that's how people end up with what you call ulcers. And that's how people end up with gases. That's how people end up with, heartburn and things like that. So when it starts chewing into your flesh, you start having pain, abdominal pain. And usually the abdominal pain comes after you have eaten. So you eat food, the abdominal pain gets worse. You eat food, the abdominal pain gets worse. Now, usually what happens is that if the issue is not addressed, the acid will continue to dissolve the flesh of your stomach, and it can even perforate it, such that the acid now, it even leaks into your stomach, into your entire abdomen, and starts dissolving your entire intestines. Or sometimes it can erode into a very big blood vessel, and you start bleeding and you bleed to death. So what may have started as gases, that's how it may lead to death. So that's why when you have issues with gases and things like that, don't take it lightly. See any doctor near you. If you don't have a doctor near you, you can come to us. If you are near us, come to us, we'll see you. Or see any doctor near you, let them evaluate you. These are issues you shouldn't take lightly. So that's how probably things like that happen. The other reason is that you could have a much, much bigger underlying disease. Like, for example, Crohn's disease. It can cause you, problems like that. You might even have a tumor, a cancer of the intestines. It can also potentiate, this thing you call gases, and the cancer may also cause death. So that's how it happens. Okay. All right. Next question. How much time do we have? We're almost done. So we have about 7 minutes for us to finish our 30 minutes. All right. Next question. Next question. Okay, let me see. Where is the next question? Okay. Toela Mansanzi Chongo. Your question is, what causes deep vein thrombosis, DVT, and how can it be treated? Now, DVT or deep vein thrombosis, this is where in your veins, you are forming clots. That's what we call deep vein thrombosis. So basically this flamboyant word, or this flamboyant word called deep vein thrombosis, is nothing but clots. Your blood is clotting in your veins. And the question is, what causes it? For females, one of the recognized causes is contraceptives, especially hormonal contraceptives. There are certain types of hormonal contraceptives that you take that can very easily lead to this. But again, understand this. Not every woman who is taking hormonal contraceptives will have deep vein thrombosis. No. In some women, when you are on contraceptives, if you suffer deep vein thrombosis, just bear that in mind that it could be the reason. But again, I need to emphasize that not every woman who is taking contraceptives will suffer the clotting of blood. Smoking. So people who smoke, like like a chimney, you're always smoking, those are very susceptible to forming clots in their veins. Okay. There are other diseases, like some autoimmune diseases, that can lead to, you forming clots in your blood. Certain drugs that you are given can lead you to forming clots. Certain medical procedures that are invasive can form clots. So certain infections, okay, can form clots. So just bear that in mind. That again, the way you treat deep vein thrombosis is that you are put on drugs that are called blood thinners. Now, where the cause is known, you are put on blood thinners for 6 months. If the cause is not known, you will be put on blood thinners for 1 year. And you'll be fine after that. Next question. This question, okay, let me put it up. At what is Olushinga? Me, I don't know what that is. So anybody who knows what Olushinga is, please let me know. What do you call it in English, so that I'm able to assist. What is Olushinga? Me, I don't know. I'm hearing Olushinga for the first time. So if you know Olushinga, please tell us. For me, I don't know. I have no idea what that is. Okay. Milambo wants to know, doctor, what are lymph nodes? Okay. Milambo, if you touch your neck or around your groin, have you ever had an injury, say, on the leg? There's a thing that pains and it grows in your groin. Like there'll be a growth in your groin that even pains when you have like if you injured your leg, you have a sore on the leg. You would feel something in your groin that grows and even pains. That growth that even pains is called a lymph node. But again, you see, with lymph nodes, I have to show you physically, or a health worker has to show you physically for you to be able to appreciate what they are. Pochilala. I can't read your last name, my brother. Pochila. But you've asked an interesting question. Doc, what is the best treatment for vomiting and diarrhea? Now, when it comes to vomiting and diarrhea, be very careful. The biggest question here is that how long has the person been vomiting and having diarrhea? Is there a fever? What type of diarrhea are they having? Is there blood in their stool? Are they having diarrhea all the time? Is their diarrhea watery, like rice water? All those things come into play. So the treatment for diarrhea and vomiting depends on the type that you have. Are we treating dysentery? Are we treating typhoid? Are we treating cholera? Are we treating food poisoning? Okay. So, and all of these present differently. Okay, they present differently. Are we treating because you've eaten something that is inducing diarrhea? Are you on, did you take a laxative that you now have diarrhea? So we have to be very careful. Diarrhea is not that simple. Maybe we should have a full talk on diarrhea so that we're very clear. Now, one of the things I want to mention is that I need you to be very careful, especially around this time. In Lusaka, there is an outbreak. In my view, and I could be wrong, it can be verified, we are seeing a lot of people coming in with typhoid, or at least typhoid-like types of diarrhea. Okay, so be very careful how you eat in public and around this time. Be very careful how you are eating in public and where you are eating in public, because typhoid is out there and it's ravaging. Now, typhoid is a very dangerous type of diarrhea. It can be fatal. If it's not properly treated, it can actually kill people. Maybe one of these days we should do a presentation on typhoid so that you can be made aware of it. Now, so diarrhea and vomiting in general, if you have somebody who has diarrhea and vomiting at home, first of all, make sure they are taking fluids. So whatever fluid you have, make sure they are taking it. If you have ORS nearby, if you don't know how to make ORS, you can make ORS with water, sugar, and salt. But if you do have ORS nearby, give them that. But just make sure, and if it's a child and they are breastfeeding, make sure you are breastfeeding this child as much as possible. Diarrhea is very dangerous in children. It's very dramatic and things change very fast and children die very quickly from diarrhea. So with diarrhea, we need to be very careful in children. Children die very quickly with diarrhea and it can be very dramatic. So diarrhea and vomiting, if it is persistent, you cannot treat it from home. Take the child to the clinic or yourself or whichever patient you have. Take them to the clinic or hospital very quickly. You cannot treat diarrhea from home and vomiting, especially if it's persistent or especially if it's repeated. All right. Okay, ladies and gentlemen, this has been your 30 minutes quick chat with Dr. Mujajati. If this works and you find it useful, the reason we've introduced this ourselves is because we are overwhelmed with questions in our inbox. And we thought that, okay, introduce a segment where we come, and deal with your questions that you come up with randomly, especially the questions you throw in the inbox, because there we are overwhelmed. We thought we'd create this 30 minutes where we just answer your questions, because some of the questions are quite similar. So maybe we can be dealing with this in this fashion. If you think this segment is useful, please comment in the comment section, give us feedback. If it's not useful, we'll discontinue this 30 minutes. But if it's useful, we'll continue with it. I will be coming, every so often with a quick chat with Dr. Mujajati and take your questions. That said, this has been Dr. Mujajati. For healthy and prosperous citizens, this segment was sponsored by Care Specialist Clinic. Do take care and do have a nice day.